Hey, welcome to our webinar. This webinar is a follow-up on the college meeting that was in Phoenix, especially on the E-Tech Day. And it's our understanding that you had many questions. And those kinds of questions were, how did you implement an EHR? Was it worth it to you? And why did you make the particular decisions you made to do that? I am Rick Martin. I'm the CEO of ezhcare. I have 30 years of experience in the technical business working for IBM. In the last 10 years or so, I've also had the pleasure to own a home health and a hospice business here in New Orleans. And I can really understand and relate to the pain that most of us go through dealing in the medical field, and how complex the documentation requirements are and the other issues that we deal with on a day-to-day basis. Today I'm pleased to have with us as our guest Dr. Richard Henry. Dr. Henry is a medical director of the Asthma and Allergy of Idaho and Nevada clinics. He's a fellow of the American College of Allergy, Asthma, and Immunology, member of the American Academy of Allergy, Asthma, and Immunology, and American College of Physicians, which is a mouthful for me to even say. He's the founder and past president of the Intermountain West Allergy Association and a permanent member of his executive board. Moreover, Dr. Henry is one of our key customers and has played a key role in customizing and developing our asthma and allergy solution. And with that, I'd like to start kind of a dialogue. I'd like to make this a free flow back and forth and ask some questions. And hopefully we can answer the questions of the audience that they've had in their mind on how to implement this technology. Dr. Henry, let me begin by asking you, give us an overview of the reasons why you decided to implement an EHR.
Well, Rick, with Medicare, Medicaid, and the insurance companies continuing to cut reimbursements, I thought we really had no choice but to become more efficient. We could either change or we could die. To me, it was that stark. Given the need for efficiency, it only makes sense to make this change now so as to take advantage of the government incentives. If you wait, not only will you be giving up the opportunity to get some extra Medicare dollars back in your pocket, you might end up getting penalized. The penalties kick in about 2 years from now, so this is the time to get on board with EHR.
Tell me, did you find it difficult to do that?
Oh, I'll be frank. It's not an easy transition. Anything new takes some getting used to, but I found it entirely worthwhile because of the financial rewards.
Can you share with us, how did you get started and what were the most important aspects to you?
I looked at EHR systems for about 2 years before settling on the Easy product, the Easy EHR. Here's some of the things that I learned in the process. First of all, it makes no sense to use an EHR that doesn't integrate with your scheduling and billing system. The goal is to make everything easier, so you don't want to have a situation where you have to use 2 different pieces of software. As anyone knows who's been involved in software integration efforts, interfaces between different types of software are usually fraught with difficulty. You just don't want to go there. We already had Easy's practice management software, and my team loved it. Here's an example of why you want one integrated system. If I'm entering data during an examination and I notice that a patient's name is spelled wrong, I can change it right then and there, and it's good for the rest of the system. It's that easy.
Did you have requirements in mind when you were just going in and trying to evaluate how you're going to do this?
Well, I knew that I wanted to use tablet computers, and I'm very happy with that choice. In fact, I find that I don't even have to look at the patient's chart when I go into the examination room. I have my tablet computer with me, and all of the charts are right there. I take notes during the patient visit, and then I complete the notes before I leave the office that day. In fact, I try to complete my notes for my morning patients before I leave for lunch. No more dictation, which means to me no more transcription fees. I also felt very strongly that I didn't want to have to change any of my basic forms or processes. Just doing things electronically was a big enough change. I didn't want to have to change the way I run my practice. Easy EHR was highly flexible for this reason. The team understands that practitioners generally want to change as little as possible. Of course, in some cases, you may want to do some process redesign. It all depends on your needs. With Easy, you can change as little or as much as you want to. To me, that was a huge benefit.
Let's discuss for a moment your partnership with Easy. You helped us enormously in developing our allergy-specific product, and I think it's important to share with the people on this call how that went and what you did for us.
Well, I was delighted to have the opportunity to help design the allergy-specific version of the software. That's another reason the system fits me so well. Here are some examples of the way we tailored the system for the specialty. My review of systems is organized into areas most common to the allergy exam. Everything is in there, but the questions I always need to ask are at the very front of the form. For patient intake, I have an allergy-specific questionnaire, making it very easy to gather a full allergy history. The physical exam is unique to an allergy practice, which is much more broad in some areas and less broad in others than the exam of a general practitioner. So the system is set up for notes for that allergy-specific physical examination. We've also tailored a list of recommendations so they are suitable for the allergist. And I have what I call an impression screen for capturing the ICD-9 and CPT codes, the allergy and the asthma codes.
So what's really nice about that is the other doctors who are allergy and asthma doctors can benefit from all this customization.
That's correct.
You mentioned some financial rewards. Can you share that with us?
Well, for one thing, the cost savings from the elimination of transcription fees is huge. That change alone is saving me about $50,000 a year. In addition, I'm saving a lot of time. In a busy practice, that can be a big deal. To me, time is money, as you know. Here's an example of how EHR saves time. I'm sure the physicians who are listening are familiar with the review of systems. There are maybe 100 questions, and if you don't ask them, you get penalized by Medicare with a lower reimbursement. But it takes quite a while, and most of this information is not relevant to the treatments I'm doing. So the only way I could save time on this step before EHR was to just eliminate it. And I often did skip this step because if I'm paying 15 cents a sentence for dictation, the profit was gone anyway. Now it's different. When I ask these questions, I'm using the checklist on my tablet computer and the data entry is done. If it was a level 3 visit before, with that additional documentation, I've got a more comprehensive level 4 note. No dictation, no transcription, better documentation. To me, that equals better reimbursement. And on a follow-up visit, it's already captured. So all I have to do is ask if there's been any changes. That's a big time savings and a big improvement in our reimbursements as well.
Yeah, and I guess it's also give you a peace of mind knowing that you've got it properly documented.
Yep.
But what did the rest of the team think about it, having to implement this?
Well, everybody in the practice enjoys this type of benefit. My team in the front office can now look in the system to find out whether a prescription has been authorized. They don't have to call someone or pull the charts or run down additional paperwork. My practice has 7 offices around the region, so when it's a remote office you're asking about, that's a huge savings, not having to track people down.
Yeah, I'm sure that's true. Many of the people that we've talked to and attendees in this webinar, in the meeting in Phoenix as well, are interested in learning about how did you implementation and training. Can you speak some of those aspects in your experience with us?
Well, one thing that helped me a lot was that I have a team leader, Sherry Packham. She's my practice manager, and she led the effort and has been instrumental in the planning and implementation. She has led the change effort, and her enthusiasm and positive attitude has made a big difference. People need that leadership when they are undergoing a change. It's always good to start early and make sure you don't try to do too much all at one time. We started with the data entry for the nurses, made sure they were comfortable with it before we even started the doctors on the new system. One of the things I had heard from some of the practices I spoke with during the research was that doctors are resistant to using the new system. So in our practice, I gave our doctors a monetary incentive. During the first month, I offered a bonus equal to the monthly savings and transcription costs to the physicians who use the EHR system instead of dictation. The second month, they were given half of the monthly savings in transcription costs. By the third month, they were completely converted to the EHR system, and they actually were liking it. When I first started using the tablet computers during the patient visits, I got a sense that some of the people were a little uncomfortable. I've always had good interchange of, speaking with the patients, interacting with the patients. They were a little put off by having a computer in there. They like that we have modern processors, but they understand that it's more efficient for things to be done electronically. But they didn't really feel that they were getting my undivided attention. What I found that works is to involve them in the process. I make eye contact and repeat what they said before I enter the data, and that seems to help a lot. They get a sense of ownership about the data when they say, yes, that's right. It's a small thing, but to them and to me, it's important.
I know you've shared with me some stories, and I'm going to just ask you this. You have a doctor in your practice that really was resistant to using the technology. Can you share kind of how he kind of come around?
Well, initially, for the one doctor, he's in his 70s, and he basically made the comment that when it was so simple a caveman could do it, he would do it. And my promise to him was, I will get it that simple. And what we did is initially we had our transcriptionist actually put his dictation into the EHR format. Then it came back to him. He reviewed everything and signed off on it. As he became more comfortable with how to drive the system, he started then changing things on his own. He started signing off. He's now much more engaged with the EHR, and it's simply because we gave him an opportunity to go ahead and learn how to do it at his pace. So I found that the system will work for people that are even resistant to it once they understand how well it flows and how easy it is.
That's really excellent. I think that kind of points out that when you make a decision on an EHR product, what's important is something that can adapt to the way you do things and allows people to learn the technology and adapt at their own rate and speed, and that's really wonderful.
Exactly.
First of all, I want to thank you very much so far, and the question I'm going to ask you at the end of this is I'd really like you to share your vision of the future with us. But
Okay.
right now, let's just kind of open this up to a few Q&A